Having a stroke is a frightening experience, and while there are common risk factors, doctors here in the Central Valley have noticed a trend we all should be aware of. More and more younger patients have been having strokes nationwide. We met one local young man who had a stroke due to a brain aneurysm at only 35 years old.
Hi Brian, how are you?
Good.
Brian Schrum never thought he'd find himself in a doctor's office as often as he's in one now.
You said there was a little...
3 years ago, he says he woke up on a normal Saturday morning.
And then there was kind of a moment where I stared at myself in the mirror and something kind of just clicked. And then like my eyes started to refocus and I was like, what was that? And it didn't seem right and just kind of weird, just kind of caught me off guard. Went to go feed my cats. And so my brain got as far as scooping up my cat food and then going over the cat bowl and then stopped. I had no other brain function after that.
He realized he was having a stroke. Thankfully, a friend was by his side, and Brian was rushed to the hospital. There, doctors found he had a brain aneurysm.
So a brain aneurysm is a sac or a bulge in one of the arteries in the brain.
Dr. Amar Khan is an endovascular neurologist and the co-director of the stroke program at Community Regional Medical Center. He says the brain aneurysm is what caused Brian's minor stroke. Though Brian does not fit the bill of a common stroke patient, Dr. Khan says
it's not only the people that are not doing what we consider the correct lifestyle habits that are at risk of stroke. And importantly, you can even be a younger person and be at risk of stroke. There's been an alarming rise in what we consider young adult stroke patients. A recent study actually demonstrated that since the mid-90s, there's been a doubling nationwide in the rate of patients in that age range who are having stroke.
Dr. Khan attributes younger patients having strokes to these risk factors.
High blood pressure, diabetes, high cholesterol, obesity, smoking, excessive alcohol use, things of that nature, and also heart disease in a variety of forms.
They're seeing patients between the ages of 18 to 45 years old more often.
So to give you an example, the other day we had someone who was only 20 years old who had ischemic stroke or blood vessel blockage stroke. Again, someone who would not fit the typical profile of a stroke patient.
In Brian's case, he didn't necessarily have the risk factors, which makes his experience of a stroke even more alarming.
Being that I'm so young, I'm not a smoker, I don't do any drugs, I drink coffee and then, have, my fun fatty foods, but generally speaking, I'm not unhealthy in any way.
Brian underwent surgery to have a mesh stent placed inside the blocked artery. It becomes a wall inside the vessel to divert blood away from the aneurysm.
And so having identified and treated that brain aneurysm in Brian's situation, I think that he has significantly reduced his chance of having this happen again.
I'm grateful to be here. Went from a very scary situation to something that is in my past now.
Dr. Khan says it's crucial everyone know the signs of a stroke. He says the acronym Be Fast works best, a reminder that you need to act fast at the first sign of a stroke symptom.
B stands for balance problems. E stands for eyes, so visual problems with your vision. F stands for face, meaning facial weakness. A stands for arm, weakness or lack of normal function in the arm or hand. S stands for speech, so trouble with your speech. And then T stands for time, which is a reminder that you need to act quickly.